You can put on and remove the MediSoft OA light by yourself in just a few steps. It is best if you sit on the edge of a chair or a stool when putting on the brace. Open the straps on the front and the Velcro fastener. Tip: attach the end of the strap back onto the strap to prevent it from damaging your clothing. Bend the injured leg to approximately a 70-degree angle and slip the brace over it. Pull the brace upwards until the fabric touches the lower edge of the kneecap. Make sure that the kneecap is positioned in the center of the opening. Also make sure that the brace is not twisted when it is fitted to the leg. Now close the Velcro closures on the upper part of the brace. Make sure again that the brace is fitted correctly. First, pull the lower strap 1 through the eyelet of the joint. Then set it to the initial setting determined with the technician or to a position that provides comfortable relief for you. Then adjust the upper strap too and close it. The rear belts are pre-adjusted by the technician. Note: the pre-installation of the relief strap is intended as a basis for orientation. According to your pain levels, you can individually adjust the strap to raise or reduce the pressure. Walk a few steps to ensure that the brace is fitted correctly to your leg. To remove the brace, you should sit on the edge of a chair or a stool. Open both straps 1 and 2 and attach the end of the strap back onto the strap. Open the Velcro closure of the brace and pull the brace downwards. You can wash the brace by hand with cold water and a mild detergent. Let the brace air dry.